Good morning, I'm Javi Zaldúa, Accexible co-founder. Accessible is a startup based on Bilbao and Barcelona, and soon we will be in Boston. We are focused on early detection and monitoring diseases through speech analysis. The first model that we have built is to early detect and monitor mild cognitive impairment and dementia. Here is John. He is 71 years old. He looks healthy, but we have just detected him mild cognitive impairment in one of our tests. As John, 50 million people suffer from dementia in the world, and 2/3 of the people with mild cognitive impairment are not diagnosed. This detection, as an average, comes up to 2 to 5 years after the first symptoms appear. So we can imagine an iceberg. Diagnosis dementia is what we see of the iceberg. We are detecting dementia in an advanced stage when people like John decide to visit his primary care doctor. And only in the 18% of the cases, we detect dementia in its first stages. Early detection is so important because it allows us to slow down the disease progression up to 5 years with pharma treatment, neurostimulation, or changes in our life habits. In Accexible, we are focused on providing a timely and an accurate diagnosis tool to early detect dementia by vocal biomarkers. So in order to do so, we have developed a model that has learned to predict mild cognitive impairment as a doctor will do. We record the voice of the patient in an iPad in 15 minutes, and we send this voice to the cloud, and our predictive model analyzes voice and language features, and will send back the diagnosis in a couple of minutes. 2 day centers and 1 private hospital are using our tool to early detect and monitor more than 240 people. We are really happy with our scores. Our tool has an accuracy rate of 92% in early detection, what it means 15 points above the traditional methods that are used today. So our tool provides important advantage to both professional and patients. First, we support the doctors to give better diagnosis. The diagnosis can be done remotely or by a nurse, and with a non-invasive method as simple as a voice recording. So doctors can focus on their patients and they reduce the administrative task. We store the data digitally, so it can be easily shared with another professional, with the patients or the families. We monitor the disease evolution and establishes alerts, and we have developed predictive models. So at the end, we help health providers save up to 50% of their screening and monitor protocols costs, and we help improve the life of people like John and their families. So the main factors that differentiate Accexible from our competitors is that the doctors are going to understand perfectly our tool. The whole process is automated, and it can be easily adapted to different channels like telemedicine. And we are the only one that we got like a multilingual approach. We have developed the model in Spanish, and we have the first prototype in English. Accessible aim is to be the leader at early detection diseases through vocal biomarkers. As we have seen, we have developed the dementia model, and we want to build the depression, Parkinson, and coronary disease model. We do want to maximize our impact, and we are aware that in order to do so, we have to build partnerships with health suppliers, public and private health suppliers like Quirónsalud to implement our tool, with insurance companies to build preventive models, with telemedicine service to early detect, the sooner the better, as we have seen with John, and with pharma industry to use our tool in their clinical trials to monitor the disease. And that's all. Thanks a lot. And I would like to introduce Itziar Vidaurreta from Quirónsalud.
Thank you, Javi, for the introduction. We are Quirónsalud, and we are the first hospital group in Spain. And after the merge With Fresenius, we are the largest hospital group also in Europe. We have more than 60 years of experience in people's health and wellness, and our national network is made up of more than 100 hospitals. Research, innovation and quality is on the DNA of our hospital group, and we are constantly searching for answers. That's why we have carried out more than 1,000 research projects in Europe and nationally also. In this particular framework of the BIND 4.0 program, this year we are developing 2 pilots. One of them is the one together with Accexible, and through this collaboration, Quirónsalud seeks to improve its mechanism of prevention of cognitive decline in its patients. Through the BIND 4.0 program, Quirónsalud wants to stay on the cutting edge of technology and also have access to new technologies and new market opportunities.